I'm going to go ahead and start our recording. And again, welcome everybody. Um, we all just watched a really wonderful presentation from Brittany Okada about the It Takes a Village project through the Utah Office of Health Disparities. So we're really excited to have Brittany here with us today. And I know that we had gotten one question in the conference platform, which I had passed along to Brittany already. But Brittany, I don't know if you want to say anything before we hop into the Q&A.
Hi, welcome everyone. Thank you so much for being here. It's always nerve-wracking to see if only one person will show up, but I feel like we have a good group. So I'm excited to take your questions and hopefully provide some answers or just have a good discussion. So thanks.
Great. So please, feel free to pop any questions that you have into the chat. I know that we had a question from Dalen from the conference platform. So we'll go ahead and start with that one, and hopefully that will spark some other questions. So the question I just put in the chat, but I'll also read it for everybody, is, are you able to provide more details about integration into home visiting programs? Our home visiting programs have been looking for resources like this one to boost their effectiveness.
Yeah, that's a really, really great question, because I think home visiting is amazing and a very natural fit for something like this. We have had a few different home visiting directors since we have done this program. But really right now we're exploring that. Intermountain Healthcare, which is one of the large healthcare providers in Utah, has approached us and wanted to fund it and then really integrate it into certain areas with the home visiting program. There's actually a meeting about that tonight. And so the thought for that right now is to have our independent organization, one of our Pacific Islander community-based organizations, to actually run the workshops and then have a very strong link with the home visiting program and referral. I think there are opportunities for a model like that, but also other models where maybe you incorporate some of the ideas of the curriculum into the home visiting program. I know that some of our Pacific Islander communities out here are really working on a, for lack of a better term, cultural broker model, where they've been doing that with mental health and other health appointments, where you have the person who would be receiving the home visiting services, the home visitor, but then also another person who can act as that cultural broker, for lack of a better term. So I think there are a lot of different possibilities and models, and we're just exploring those now. So hopefully that answered your question. Let me know if you have more questions or if that didn't answer it. All right, what other questions or things would you like to know?
This is Cheryl from AMCHP, and I'm such a fan. I've been downloading everything. Expect me to contact you about a lot of stuff coming up.
Awesome.
I'm just really loving the way that you are, talking about disaggregating data, but also keeping the qualitative piece in mind, and I guess I'm trying to formulate a question instead of just fangirling here. I want to, did you try to, was this kind of an attempt after some failed attempts, maybe? How did your place of work decide that this was the best pathway?
Yeah, I think that is such an interesting question to tell sort of the backstory of it, right? I think this is a really hard question. I think our director, Dulce Diaz, this has been an effort that we've been doing since 2010, right? So almost 12 years now. And so it's hard to speak to exactly what happened, but I think she's pretty visionary in her approach, because our office isn't state funded, really, only our director's position. And so we rely a lot on federal funds out of the Office of Minority Health. And so a lot of times their projects will drive us But she's been able to, with that funding, think of future projects and how we might leverage that to benefit the whole state. And so I think she'll often come up with projects to say, let's do this or let's do that. And then to take time to invest in them. And so we have been working with our Pacific Islander population and really listening and talking with them, and to give time and intention and investment to them has really been a labor of love. And also, gosh, such a challenge to continue to try and invest them. And I see Lynn Nilsson here, who's our MCH Bureau Director, and her role in funding some of these efforts with Title V has been incredibly amazing. So I think that it's the vision of our director, it's those community connections and them driving a lot of things, and then just that partnerships across our agency that have allowed us to really dive deeper and do some of the oversampling surveys and some of the focus groups and further discussions. And it's really, gosh, I don't feel like I'm answering your question perfectly or in any way, but it's really been just, it feels like the community just keeps leading us one step and then another and then another, if that makes sense. So
No, I think you're answering it great, because it's, it's not just a magic bean. You, like you said, you've taken a lot of time to invest and listen to your community, and so I think you've answered it perfectly, because a lot of folks aren't, maybe they can't, but aren't doing that, and they're not being successful. And then also, I think you said that it took 10 years, so it's kind of long haul investment, so I appreciate that. Thank you.
yeah, and I think I see you're the epidemiology and evaluation at AMCHP, and right now our office is really trying to figure out, how to measure. It seems like so many of the metrics that we do have, or the data sources we do have, don't quite quantitatively describe what's going on. And so I really am growing in this qualitative space to really see how that can add to the conversation, and communities really share and fill in those blanks that we're not seeing, especially with small numbers. So
I think you're hitting on the head, and I think the answer is in small area analysis, which is all qualitative. So I think you're on the right pathway from the folks that I've talked to. I mean, obviously, you're doing a good job. Thank you.
thank you. Sandy, I think, has the hand raised.
Hi, yeah, great presentation. Has me really thinking. We're from New Jersey. I'm from New Jersey, and we do have a very small population of Pacific Islander folks. But for us, we have a very diverse population of many groups that we kind of lump into the Asian category.
Yes.
And you're right. The larger group masks the smaller groups, right? And so we've been really working and thinking about how to disaggregate the groups so that we can talk more about the various groups within these larger categories rather than lumping them all together, because they don't have shared experiences or shared cultures. I do have a question, though, about how do you work with folks that identify themselves, or children that have multiracial households? Because that's often where we struggle with how do we put people in the right category for analysis, and how do we work with that? And I don't want to say the right category, because we don't really know which is right. I feel like they're all proxies for something. But it's kind of like going, okay, so if you're this, do you go in this category? Do you go in that category? How do we work with that? So do you have any thoughts on that? Because we're becoming a more diverse but also integrated population.
Yes, as someone who is multiracial or multiple, I always feel like, gosh, you're really trying to make me choose between my mom or my dad. Like, how do you even make that choice? Like, don't make me make that choice. You know what I mean? So there's a lot of different methods behind that, right? We are currently developing practices for that. And Oregon has really done a lot of things. So we're talking with them about that right now. So definitely reach out to Oregon. They've done a lot of work. but I think when you're talking about race and ethnicity data, there is, with ACS data, there's always the alone or in combination data, right? And I like to use that in different ways. So the alone data is nice for mutually exclusive groups, right? And comparing. But I think the alone or in combination is really better for community work, if that makes sense, because how you identify is so personal, and how those connections between community support and behaviors and different health practices really does not fit, like you're saying, well into any sort of boxes. And so, like when we're working Pacific Islanders, we actually really work with anyone who identifies as Pacific Islander, and Pacific Islanders are super multiracial, right? Like, oh, really multiracial. And so I think for me, it depends on which lens you're using and what the purpose of your work is. If you're really trying to look at health disparities, like among groups or in comparison to the state overall versus within group analysis, that alone or in combination can really provide you the latitude that you need to look at a more comprehensive view. In our standards for analyses and to reduce the burden on our data analysis, we have talked about that primary race or ethnicity identity, which I don't love, but I also understand the need for that, and letting people themselves identify, oh, this is probably my primary racial ethnic identity, or what I would choose, I don't have one. I consider myself as multiracial. Or I don't know if that answers your questions, but those are some of my thoughts around it.
You did, thank you. But just one follow-up. So for our birth data, the baby's race is not identified in a birth certificate. It goes by the mother's race. And for our state, we have about 30% of babies that don't have an identified other parent category. So we're a little bit on the, floating out there, not sure what's going on. So that is cumbersome, because when we move to child level data collection, that's different, because then we can ask families what they're, what they look like and what their whole composite is. So I don't know, we're struggling with that a bit.
Definitely. I remember when I was initially looking into the linked birth death data sets for infant mortality, that I did look at NHPI in combination, and you do have, like you said, 30% where the other partner isn't identified. So you actually don't know the child's race or ethnicity. You're really focusing on the mother. And that's where I think some of those, if you're able to, and you have the funding or capacity to do some of those follow-up conversations about that particular group, or follow-up surveys, or a study or something can help shed light on some of that, because that's really interesting. 30%. Wow. I'll be interested to see what you do.
Yeah, me too. Thanks.
Awesome.
So we have a few questions that came in the chat. The first one came from Emily. With this work taking place over a number of years, did you allocate particular positions or staff towards this work? We are always running into capacity issues and competing priorities. So I am just wondering how you maintained this work over time.
This is such a good question, Emily. I really appreciate it, because it was always, part of my salary or part of this person, or always looking for the next funding that could help. And so I think I mentioned in the presentation, it started off as OMH funding, and then Office of Home Visiting helped a little bit, and then we had more federal funding, and then Maternal Child Health Bureau came in with so it really was a lot of gymnastics on the side of my director to try and piece those together in within our own positions, doing that braided funding, so that it wasn't a particular staff member. It would be like a certain amount of my time. And then if we're able to write into the grant a certain person, which we always tried to have a Pacific Islander member on staff, that one would be fully funded by the particular funding. And so we tried to build in institutional knowledge with a position that's always going to be there, and allocate some of that time there. And then as funding is available, add on those other positions that could devote fully to that work. It was very difficult to maintain over time. I think there's always, gosh, I so relate to you with capacity issues and competing priorities. Did that answer your question, Emily?
It did. Yeah. Thank you so much.
Awesome.
Great.
So Sharon, is that the next question? Okay, so Sharon asked about hiring community members, full-time, part-time, hourly employees. So we have a couple different modes of funding community members. So sometimes we do hire on community members as a worker in our office, especially if it's a very particular program. It just depends on the particular funding source. We did have people on full-time, and then we did have some on part-time, but time-limited temporary employees based on the funding. Another mechanism that we have is contracts with community-based organizations, and then they employ the community members. And so we contract with our National Tongan American Society, the Queen Center, Utah Pacific Islander Health Coalition. We have several different community-based organizations as a way to support them. So I think we take a multimodal approach to funding and hiring community partners.
Thank you.
Yeah. What other questions for everyone who's here listening?
The only other one I had, and I mean, I can go back and relook at your slides, but you talked a little bit about surveying, getting some data that way. Could you speak to that a little bit more?
Yeah, so we did a few different types of studies or surveys. One, I believe we were, as far as I know, and this could be wrong, so I'm sorry if this stomps on someone, but I believe we were the first state to conduct a BRFSS type of oversampling survey in English, Tongan, and Samoan. And that was based on our community members. And in that survey, we did find that those that were Tongan or Samoan speakers did have worse health outcomes. And that was a big limitation of conducting the BRFSS only in English and Spanish in our state. We haven't been able to do one since, but that was a really interesting survey. We developed, because we were focused on birth outcomes, we developed a surname sampling methodology with our partners to look at birth data, and then based on surname, sample Pacific Islanders to ensure we were capturing Pacific Islander household families. And in the absence of race ethnicity data. We also did, gosh, sorry, those are other projects. We have a lot of projects. So I was thinking about our mental health survey project. We did a lot of focus groups as well. And we also did a particular study focused on Black African American and Pacific Islander mothers who recently had a poor birth outcome. And we actually trained community members to conduct some of those interviews. So those are all the ones I can think of. Do you have any questions about those or want to know anything more?
No, that was helpful.
Okay. Any other questions or comments or discussion topics?
The only other question I had written down, this is Sharon, sorry to be,
Yeah.
but what was the other you said you had another presentation.
Oh, yes.
And what was that
So,
called again, please?
Yeah, this is called Embrace.
Okay.
And it's tomorrow evening. I won't be there to answer questions about it, but my research assistant will. That is a randomized research study focused on Pacific Islander women. So with It Takes a Village, we focused on infant mortality. With Embrace, we focused on maternal mortality. And this is a super wholesome research study. It's all about embracing women where they're at. And we have a wonderful partner, the Wellness Bus. That's literally a bus. It's an RV that goes out and does screenings. And we've integrated self-care and how to focus on mental health. And we do these cultural workshops that are just out of this world. We've heard some just amazing things from women and their stories, and I love it. I love It Takes a Village. It was my baby, but Embrace is like the grown-up version of it that we've been able to evolve and do. So yeah, I loved that presentation. So thanks for asking. I was going to share that.
I actually just thought of a question I had, Brittany. I was so moved by the videos that you were sharing in your presentation, but I know that you said that it wasn't like the whole video. Is there a way for us to view those?
Oh, for sure. We have a whole website devoted to It Takes a Village.
Amazing.
Let me grab it. Oh, we just updated our website, so I feel like it isn't there anymore. But they are on YouTube. Yeah. Let me see if it will link out. Okay, here we go. It's kind of a weird thing because we're going through a website update, but our whole curriculum, all of our videos, everything's available up. We have the framework, we have the all of the materials, our evaluation, our facilitator manual, our participant workbook, everything, all of our activities, it's all up there.
Thank you so much. I'm going to have so much fun with this. This is amazing. This is a beautiful site too.
Yeah, thank you. It's really interesting. Our cultural advisor, Lavinia Taumapealatu, who helped with this, she actually just applied for a Fulbright scholarship and got it to do kind of a similar model in Tonga with emergency preparedness. So it's been really amazing to see some of the Pacific Islander women who have been involved in the project and like going from a cultural advisor to like doing her own thing. And then we have another one, Tima, who was actually a participant who's going to be leading the effort for Utah from her community-based organization. It's really, really amazing. I'm so proud of all of them. It's really awesome.
That's amazing. Thank you for sharing those wonderful achievements with us. So I just looked at the time. We're basically at time. I think we had until 6:10. So I don't know if folks had any other questions. I do believe that if you all have questions, you can, I'm sure that Brittany would love to get those questions directly. You can chat her through the conference website, or you could also always add questions like to where you were watching the recording. And, you know, we can try to keep an eye on those. But anyway, if you all have any other questions, yeah, feel free to reach out. This has been so wonderful. Thank you so much, Brittany, for taking the time to chat with us and share all these wonderful thoughts. Any other thoughts from anybody else before we close?
All right, well, thank you so much. It was great to talk with you all. I love talking about this. We actually had a podcast, if you get a chance to listen to that. It's on the More Than Half, and Nia and Tima talk in that, and it's really beautiful. So
All right. Thank you all so much. Have a great rest of your evening. Bye.